Life Project for Africa is a group of dedicated volunteers who are willing to make a difference in Africa. Their goal is to save life and to give hope.
When they're struggling for their basic subsistence, for things like water and health care, people need to have hope in their lives. When I met Stephen Moshe and discussed with him firsthand and learned how he had really an unmet population of people. He had communities that none of the aid organizations nor government help were reaching.
When we heard about the stories there, we wanted to do something. So what we did was we provided an infrastructure to help others there. We have a team of people here in the States, but we also have a team of people in Africa and in Tanzania. We know for certain that the hospital's equipment is going to actually arrive and be in good working order, and that the lights will stay on.
Orphaned children and other children that have parents come to our hospital for treatment, and many of them are poor and they cannot pay. So Life Project supports them and provides free medication.
We don't have any additional support apart from the support that the Life Project gave us. And we've run the hospital on debts. And each time I've thought of closing down this health center, but I feel so guilty that tomorrow somebody is going to say, oh, you closed me, you closed your door. I was entering to get life.
When we started, we were mainly focused on helping with the building of the hospital, but then we realized that building of the hospital is not going to solve that many problems, because providing health care and not expanding to education and clean drinking water and mostly helping people to help themselves.
We save lives through assisting in development of groundwater by building wells.
Tanzania has been hit by drought for the last 3 years, and getting water was a very big problem. I should say, first of all, most of the diseases in Tanzania should be, say, 84% of the diseases are caused because of lack of water. We are going even to rescue many lives, many people, many children, once we get the well drilled.
Education is key to health. Education is key to progress.
What we are trying to do with the Orphan Project is expand the sponsorship for these children that basically have no one, and try to help them obtain education and achieve a better life.
What is most gratifying to me is the children, to see them smiling, to see their pictures in front of the schoolhouse with books, clothed, fed, knowing that they have had the basics of life.
I'm so grateful to Life Project because many children are seeing hope, light of hope. They're seeing life. They feel they're living, they feel they're loved, they feel there are people who are around them who are supporting them.
To see a container go to Africa with medical supplies, a child comes and receives the medical supplies, medicines, care, and this child was going to die, and the child comes back to life, and the mother is full of joy, and the whole family is rejoicing.
I am so fortunate to have what I have, and I know there are many people here who feel the same way.
It's amazing about this country is that people just want to be involved, and that's what made me wanting to be involved with Life Project for Africa, because I realized that as an individual I could do something.
Life Project provides a unique opportunity for us to directly get involved and directly help and directly respond to this need. So many organizations, I've read about their cause, and I've been touched by the plight of the people that they're trying to help, and I read more into their specifics and see that only 65% of the money actually makes it to the people that they're trying to help.
Life Project is operated entirely by volunteers. We have a volunteer board of directors, we have volunteer staff and administration. There are no paid positions at Life Project for Africa. Every dollar we collect, therefore, can go directly to the needy. We can wire the funds directly to the recipient hospitals and orphanages and other facilities that we support. There's something to the authenticity of knowing that a dollar donated today is literally in the hands of someone who needs it tomorrow. And there's also great benefit in understanding the people who need help are being identified and they're getting help. What you can buy for $10 and what support and medicine and healthcare you can provide to a person for $10 is phenomenal. I mean, you can't provide almost any type of healthcare here for $10. And so when you start adding up all those small amounts and more modest amounts and realize what an impact they can have, you realize that for tens of thousands of dollars, you can have an enormous impact. You can actually build buildings, you can staff facilities.
There is a lot of hope with Life Project for Africa. It is a project, though, that will continue for many, many years.
As a person born in Africa, lived in Africa, and worked in Africa, and witnessed all these challenges, I feel very, very happy and gratified to see what Life Project for Africa is doing. Thank you for considering your support for Life Project for Africa.